Pneumothorax. Pneumothorax is a condition where there is an accumulation of the air between the parietal and the visceral pleura. The pneumothorax is one of the emergency conditions that arises due to traumatic or iatrogenic causes. There might be two types of pneumothorax, mainly open pneumothorax and tension pneumothorax. Open pneumothorax is where the pneumothorax has occurred but without any hemodynamic compromise, whereas tension pneumothorax is a condition where there is, along with the pneumothorax, there is a hemodynamic compromise. So the mechanism, how it is. So when there is a pneumothorax, means there is usually an injury which leads to increased accumulation of air, but it follows a one-way valve mechanism, means that the air can enter inside the pleura but it is not able to come out. That leads to increased in the air inside in the pleura, leading to the lung affected gets collapsed, and in order to compensate that, there will be hyperinflation of the other lung. In doing so, it also starts to have a compromise over the cardiac. The mediastinum gets compressed, leading to fall in the systolic blood pressure. The stroke volume will be increased, leading to tachycardia. And because of the hyperinflation, there will be tachypnea. And there will be immense pain. Breathlessness might be felt by the patients. Coming to the examination point. So when we examine a patient, usually the findings that we see is there will be absent breath sounds on the side of the pneumothorax, and second is hyperresonant or tympanic note on percussion. So it is overall a clinical diagnosis, and usually the investigation are not of much importance. They act as an adjunct to the clinical diagnosis. So for the investigation, we can go for the chest x-ray, where we can see the pneumothorax, and also there will be shift of the trachea to the opposite side and the mediastinal shift and hyperresonant lungs on the opposite side. Also, we can go for the EFAST, which stands for Extensive Focused Assessment Sonogram in Trauma. So the signs that we can appreciate in the pneumothorax is stratosphere sign, barcode sign, and loss of seashore sign. Coming to the management, it's an emergency condition and we have to relieve the air. So needle thoracocentesis is to go for as an emergency management. So we take a wide bore needle and we tend to release the air via passing the needle. In case of adults, it is the 5th intercostal space, mid-axillary line, and in case of pediatric groups, it is the 2nd intercostal space in mid-clavicular line. Coming to the definitive management, it is the tube thoracocentesis, the chest tube insertion, which is being connected to the underwater seal bag. So here the chest tube is inserted in the triangle of safety. Triangle of safety is bounded anteriorly by the anterior axillary fold, posteriorly by the posterior axillary fold. The roof is the apex of the axilla, and lower is the 5th intercostal space. So here we make a stab incision and we insert the chest tube. Make sure the opening of those two tubes has to be intrathoracic and not somewhere on midway, because that way it is of no use. There will be still accumulation of the air and it's counterproductive. The chest tube is, as I mentioned, it is being connected to the underwater seal bag. So it actually prevents the accumulation or the re-entry of the air back. And when we tape it, we have to tape on 3 sides, leaving a flap. So it basically, as I mentioned in the mechanism, that it works as a one-way valve mechanism where the air is able to enter in, but it is unable to exit out. So here we try to reverse the process where the air is able to exit out by making that gap. And apart from that, we have to monitor the vitals, and then we have then IV fluids, analgesics, and in case we can cover with IV antibiotics.